Hi, I'm Degé Coutee with Patient Advocacy Network at cannabissaveslives.org, and this is your weekly installment of the Compassion Flower Report. I want to get right into it with you. This first story is one that I found right at the beginning of the week after the last show, and I thought it was kind of interesting. We'll talk about why. Um, Trump seeks corporate lawyer for U.S. Attorney in California. This is out of the Star Tribune out of Minnesota. This is in the national news section, and this is an AP story. And it says President Donald Trump plans to nominate a former federal prosecutor who is now a partner at a major corporate law firm to the position of U.S. Attorney in Northern California, the White House announced on Thursday. Anderson, Stanford Law School grad, clerked for U.S. Supreme Court Justice Anthony Kennedy for 1 year, 91 to 92. Went on to serve as first assistant U.S. Attorney in San Francisco and is now a partner at Sidney Austin. He has represented AT&T and Wells Fargo among other corporate clients. I'm assuming Sidney Austin is the corporate law firm that he works for. I'm honored and grateful. There's a long quote there about him being honored and grateful. U.S. attorneys serve as the chief federal prosecutors in their regions. Anderson's territory would include the San Francisco Bay Area. Attorney General Jeff Sessions announced a new policy in January allowing U.S. attorneys to decide how aggressively to prosecute marijuana cases in states where it's legal, though he has since said federal prosecutors won't take on small-time pot cases. Story goes on a little bit about the transition, and it mentions Melinda Haag, who was a U.S. attorney, and it says that how she was very unpopular for going after the medical marijuana dispensaries there in the Bay Area. So I thought that was an interesting story because AP thought it important enough to put out a story that announces who is going to be taking over as U.S. attorney. Potentially, he needs to be approved by the Senate, but it announces who is potentially going to be taking over that area, and it goes to show that it's still very important on a national level who sits in that seat and who is overseeing what happens with potential criminal cases in California, in the Bay Area, that it's still very, very important. So the next story, the story that I found that just is less than 24 hours old. I think this is a 15-hour old story or so. And I think it kind of ties into this. Even it's not a San Francisco story, but it's a Central Valley story. This is out of Tulare. 50,000 marijuana plants destroyed, 4 Tulare County men arrested. On the heels of federal and state agents announcing the success of a California-wide marijuana operation, doesn't say what kind of operation, Tulare County Sheriff's deputy uncovered yet another illegal marijuana grow site. Over the last month, deputies have destroyed thousands of marijuana plants found on public lands and private property. So you've got federal and state agents announcing what they call the success of a statewide operation. Here you've got Tulare deputies, just this one county, that they've destroyed thousands of marijuana plants just in that county alone. This week, detectives with the Tulare County Sheriff's Office TAGNET, that's capital TAGNET team, they issued a code enforcement abatement warrant, and law enforcement paid a visit to the home. It says during the service of the warrant, detectives saw illegal marijuana grow gardens on the property. Photos taken at the crime scene show large marijuana plants hidden in a cornfield on the property. Small plants were also potted in neat rows. While searching the area, detectives found 4 people at the home. It lists their names and ages. They were later arrested and booked into the Tulare County pretrial facility on suspicion of maintaining a residence, drug use, sales, cultivation, possession for sales. During the operation, detectives also found a large amount of trash, pesticides, herbicides, a total of 50,000 marijuana plants. 2 pounds of processed marijuana were found and destroyed. I'm gonna say it's a little early that yeah, they just had a little bit there maybe for themselves, and they were waiting for the rest of that harvest. So I want to keep up on this story. I find it interesting that we've got state and federal agents saying that they're working together, at least according to this uh, story out of the Visalia Times Delta, that state and federal agents are working together on a statewide level to go after grows. And we've got a situation here where 4 people arrested with 50,000 plants in a state where nonviolent crimes have become, it's very lenient. People don't spend a lot of time in jail when it's a nonviolent crime. I have no idea how the new law in California might take down any, potentially bad charges. Bail is something in California that has just, they're going to do away with bail. So it'll be interesting to see if this case gets taken on by California or if they decide to turn it over to the feds. It's 50,000 plants. Isn't that close to what Eddie Lepp had? I'll have to take a look at that, but I want to think he was in that realm. He did a severe federal sentence, so I'll be very curious to see what happens with this, and hopefully I'll be able to find more information about what happens to these people arrested. And I find it interesting also, this story. There's no alleged anything. The story just goes on to say, they're arrested and they were searched and this was found, and there's no alleged anything. So normally I don't report, on stories that are clearly not medical related, but I thought these were important. I thought the one about the AP doing a story on who will be the next who potentially will be the next U.S. attorney in the Bay Area, and that U.S. attorneys can use their discretion. And we've got a state-federal joint agency task force who are going around busting people in California. And like I said, the other thing is seeing how these charges lay out, and if these guys get tried on a state level or a federal level. This brings us to our next story. We're going to go back into our primary theme, which is compassion. This story just came out, and I thought it is very, very important to get this story out there. I'm not going to read the whole thing, but I'm going to read some really, really important parts. And like I said, this takes us back to compassionate care. That's SB 829. That's that ability to give cannabis away for free. Story out of Santa Cruz. Medical marijuana users left in limbo as co-op struggles to regroup, reopen. Kaya was 11 months old when she began seizing. The episodes quickly became more frequent and severe, and doctors eventually diagnosed the infant with a rare genetic disorder called Dravet syndrome. We've talked about this before on the show. But despite a cocktail of prescribed medications, her condition continued to worsen, according to her mother, Marina, and I think this is probably pronounced Blach. Her daughter began seizing multiple times a day, with each episode lasting almost half an hour. Can you imagine that you are the mother of a toddler and your toddler starts having seizures that last up to half an hour each, multiple times a day? Her mother says she became temporarily paralyzed. Her whole left side of her body would go limp. She couldn't walk. She'd be in a coma state for 3 days in a row. Dravet syndrome affects fewer than 1 in 15,000 children, proves fatal. More than 20% of the sufferers before age 20. There is no known cure. And those who survive the seizures are almost always left debilitated with trouble walking, speaking, and learning, among other side effects. talk about the medication she was prescribed, number of medications, none seemed to work, only leaving her suffering still from the seizures, but now side effects. Her mom says she was a vegetable when she was on all those medications. And she says the infant went code blue 4 times, needing to be airlifted for resuscitation and treatment. Blanche and her husband were left in a state of despair, fearing the unthinkable had become the inevitable. She says it was the 4th code blue that she was willing to try anything. She saw a documentary about a man who was successfully treating his son's seizures with CBD, and she began looking for a resource, and she says that she found a cannabis co-op not far north from their home, oriented around patients with terminal and chronic conditions, the Santa Cruz-based Women's Alliance for Medical Marijuana. Now 8 years old, Kaya is off all synthetic medications. Her seizures have fallen from multiple times a day to no more than once per week. Where they no longer last 20 minutes, they last less than a minute. Her mom says that she's one of the few children with this syndrome who is thriving. She credits the success to the cannabis oil that Kaya takes 3 times a day. Then we get into the financial part of it. Insurance won't cover it. WAMM's members get to pay on a what you can pay basis, and did so. The oldest cannabis co-op in the nation shut its doors January 1st. Let me repeat that. Valerie Corral's WAMM, the oldest cannabis co-op in the nation, the one that always gave cannabis away for free, closed on January 1st because of the rules. WAMM gifted, I'm referring to the regulations in Sacramento, in California. WAMM gifted the Blaches almost a year's supply of the cannabis oil, which contains both CBD and THC. They have the syringes. They're worried about what they're going to do when they run out. Be $2,500 a month at a dispensary. They're not sure that it would be the quality as what WAMM was producing with their organically grown medicine that they grow right there in their own gardens. The organization is one of a number of compassionate care operations that have reportedly been forced to close their door under California's new recreational regulations that levy hefty state taxes and licensing fees. If you've been following the show, this is exactly what I talked about in our call out to patients, that compassionate care is important. It's not, there aren't a huge number of people who do what Valerie does, but it's important to have it. The medical marijuana users who can't afford to pay the hefty premium at the commercial dispensaries say they have been forced back into the black market, where they're unsure the quality and efficacy of what they find. So again, that goes back to other things I've been saying. Talks about SB 829. We'll talk about that. WAMM being forced to close. Valerie Corral, they talk to her now. She had epilepsy. That's why she founded this organization. She co-authored Proposition 215. Talks about some of the hard times that she's had dealing with landlords. And it says that on January 1st, they closed their door to 1,000 members with severe conditions. So yeah, this is, again, and I'll just, and they interview some other people who've gotten their medication from them. This is a person here with lupus, another person with stage 4 cervical cancer. So it's you can find this story. Like I said, I don't want to read the whole thing to you. But yeah, it takes us around to this issue of compassionate care. And yes, I am encouraging everyone to get a hold of your California senator and assembly member and tell them you support this. However, I will tell you that the way it's written, it's not going to protect somebody like Valerie. She goes into that in here as well. She recognizes that in order to continue doing what she does and the way she does it, that she's going to have to get some type of level of licensing. And the reason for that is this is the thing that changed and they added. Um, and we'll see how this works and how organizations like WAMM and others can figure out how to develop these relationships and continue taking care of these patients. Um, a licensee who holds an M retailer license, an M retailer non-storefront license, or a M micro business license that is authorized for retail sales may contract with an individual or organization to coordinate the provision of free medical cannabis or medical cannabis products on the retailer's premises. So, being able to provide compassion through one of these retailers, it's better than not. I think that an individual organization that can coordinate with one of these retailers, I think that will help push. Um, Hopefully, it'll create a system where you have nonprofit organizations like WAMM, like the Patient Advocacy Network, who really push these retailers to get that compassionate care license and help to create distribution programs. Because if this is the way it's going to go, then we have to do it. And I can tell you, I know why it's going to go this way. I'm not happy about it, but the state is not going to allow any type of loophole that makes a medical marijuana licensing situation tax-free. It's why they're getting rid of collectives and cooperatives, and it's why they're not going to allow for a business like WAMM's to just be nothing but a compassionate care business. The state is not going to, even though not very many people want to run and do what WAMM does. There's no money in it. It's truly compassion. Um, so, the state knows that this kind of organization that WAMM is running and running it as a cooperative, there is a tax loophole that based on how the members of the collective and cooperative have agreed to come together, it creates a tax loophole, and the state's not going to allow that tax loophole. So I can't imagine anytime soon. I think we can lower the taxes on the retail side for compassionate care and for medical overall. I think these are workable within that structure. I just don't think that that the state currently in this state of affairs is going to allow for a license that creates a completely non-taxable loophole for that business. Like I said, I'll let you read the story. It's on our social media. I'll put links below. But yeah, you'll see that Valerie recognizes that that if she's going to continue to serve these patients, that she's going to have to come up with she said about $100,000. And I don't see why we shouldn't have fundraisers and WAMM Fest and whatever and help Valerie create what she needs to create in order to survive this. I think that's a very worthy cause. And hopefully I'll bring you more about that. We'll find out if Valerie is going to try to figure out how to survive this, or if she's going to pack up. She hasn't yet. I offer her so much love and support, and I'm going to figure out if there's anything that I can do or the Patient Advocacy Network can do to help her overcome this so that she continue to do what she does. And the last quote on that one of the quotes from her story is, she says, "I have resisted, resisted, and resisted this, but the writing is on the wall," said Corral. "There won't be a WAMM. There won't be anyone to serve the poor." And that resisted, resisted is that's what she's talking about with, uh, basically fighting City Hall, if you would. Not that Santa Cruz City Hall has ever been anything other than great to her. But we're gonna continue to follow this. I can't imagine that the state wants to get rid of WAMM. We've got to figure out how to get WAMM back online, and we need to advocate for them, and that will become, I'm sure, a call to action. But right now, with respect to compassionate care, this is Marley. With respect to compassionate care, support the bill. Let's not let it die. It is being it's on both floors. It's on the Senate and the Assembly. It's in process. It's going back and forth. They're still doing edits and amendments. So when you find what I'm going to send you in the links below to find that, there's a link to how to look up your California representative, give your senator and assembly person a quick call, and just so simple on the phone, just say, they probably want your zip code. The most important thing you can say is, I live in your district, and I'm a registered voter, and I support SB 829. And let's get compassionate care in the regulations, and then let's figure out how we can make it better, make it more accessible, expand it, lower those taxes and fees, and get the compassion back into our laws. The next story, I know that we've talked about patients not using dispensaries anymore, saying that the taxes are too high in California. And I've been hearing from organizations around the country that, they're having struggles in their state as well. No one's been super specific yet as to what those struggles are, but I'm going to continue to learn them. And here's one of the first steps. Another story I found this week: Colorado medical marijuana sales take a nosedive. Is the end nigh? So this is very interesting, where in California, patients aren't going to the dispensaries over taxes. Here, the patients are not going to, they're still going to dispensaries, but they're just changing their status, because I guess it's a hassle in Colorado to be a patient. It's just easier to be recreational. Medical cannabis is on the decline. Sales have dropped for 19 straight months in Colorado. That was the expectation as recreational stores took hold, but the data shows the declines have accelerated. Tim Cullens, who runs Colorado Harvest in Denver, got into medical cannabis because he believed in its medicinal properties. It's near and dear to my heart. This is how we started. It's how we feel in California. It's what we feel passionate about and still do. It's hard to watch it just morph into a recreational market, but that's what is happening, is what Cullen says. 90% of Cullen's sales are recreational, something he calls a dramatic shift, but it's a shift Cullen and others were expecting. I'll tie this into what I've been learning here in California. There are about 200 recreational stores in Denver alone, helping to increase access and lower prices. Getting a medical card is also relatively onerous. A patient has to visit and pay for a physician, get a recommendation, file paperwork with the state, pay a fee. Then they have to find a store and designate a caregiver. They have to find a store and designate a caregiver. So does that mean patients don't get to go where they want to go? That's interesting. And I think that ties into something else they say here about plant numbers. Or you can get the same or similar product on the recreational side. You pay a little more tax, but at the end of the day, there's a lot less planning and work that goes into it, Cullen pointed out. Recreational cannabis is taxed at a higher rate, but given how prices have fallen, someone would have to be a heavy user to notice a big difference. So the prices are pretty good. So that little bit of difference doesn't seem to matter to patients. They're just not renewing their paperwork because it's a hassle. It's a way of, unfortunately, this is a method of basically hiding the patients. It's making being a patient such a burden that you just go over to the recreational market and and make the medical part of it just disappear. And you'll hear that some of the people in Colorado are really sad about that. Since the peak of summer 2011, more than 40,000 patients have fallen off the medical marijuana registry. And since recreational stores opened in 2014, the registry has fallen more than 20%. There are now a little over 88,000 patients in Colorado, according to their Department of Health, Public Health and Environment. The decline in medical patients, especially in Denver Metro, poses a challenge for dispensaries, in part because they need a certain number of patients to be allowed to grow a certain number of plants. So I guess if you fall off the state registry, this just, it sounds like it's very, the number of plants grown is based on the number of patients, and that patient has to pick where they go, and that one location is going to grow their plants. When you're forever chasing patients, and then you're worried about having too many plants should the patients drop off, said Wanda James, owner of Simply Pure in Denver, it becomes a ridiculous business model that the state of Colorado put together that makes absolutely no sense from a business standpoint or from a patient standpoint. And that's why medical marijuana is not working. You go on to James. I want to talk to you. So there you go. Patients having a tough time, not just in California with the rules. Hopefully we'll be able to massage these rules and have them make sense. Just a couple more headlines before we go here. These are not ones I'm going to read you the story, but I'm just going to tell you what they're about, and then you can go below. But the other story, California has a serious compliance problem. This is about the tracking software. And then some of the other patient stories here. Illinois opioid patients may soon have medical cannabis alternative. Mormon church ramps up opposition to marijuana effort, medical marijuana effort in Utah, speaking out publicly. The Oregon Liquor Control Commission vastly reduces daily purchase limits for medical cannabis. And unraveling DNA of medical cannabis. Israeli firm and Swiss-based firm will use cutting-edge algorithms to precisely map the genome of the cannabis plant. So please, you can find out more about these stories and where you can learn about them below. You can sign up for email updates with us at cannabissaveslives.org. Just sign up for email updates. We send out a notice of a digest. We used to send out the digest in the email. Now I'm just sending a link, and you can go over to our blog and get the digest. I wanted to streamline things and make things as simple as possible for our audience. I want to thank you for watching. I also want to remind you that we need your support. PAN is a 501c3 organization. Your donation is tax deductible. It can be made over at our blog, Cannabis Patient Voice and Blogspot. Again, I'll leave that link as well. Click that donate button. Donate whatever you can. You get a tax deductible receipt. We'd love for you to become a regular monthly sponsor at whatever amount is right for you, so that we can do what's right by the patients and make sure that patients have safe, affordable access. Make sure that compassionate providers and authentic patient providers and those boutique growers and mom and pop shops that love taking care of patients, that we've got rules that make sense for everybody, bringing everybody to the table. Please also share, like, and subscribe. We appreciate it. I thank you very much for watching. This is Degé Coutee with the Compassion Flower Report.